Very good morning to one and all present here. Today we are going to discuss about a DT session. The topic of the session is smart healthcare. So healthcare is one of the important aspects in our day-to-day life because it helps us in supporting to take care of our health. And this smart healthcare will give us lot of inputs by helping us in overcoming those flaws. So here we have Samshika and team and she will be explaining about the smart healthcare.
So myself Niranjan, I'm going to introduce about the smart healthcare system. So basically nowadays the health issues are more occurring in this world. So from child to elders, most of them are getting affected easily. So we are introducing a smart healthcare system because due to hospital insufficiency and various challenges occurred. So there are small prototype we brought into our world. So the empathy will be behind.
So my name is Mohammed Umar. I'm from CSE IoT department. I'm going to explain what are the challenges a person face while going to a hospital. So let me take me as an example. If I have any issues or sickness, I go to hospital. When I go to hospital, the first thing is there is overcrowd when it is in weekends, Saturdays or Sundays, and there is a less number of nurses available. When I consult the doctor, he charged me a large amount of money. So it would be better if I take care of myself in a better way in the first itself, instead of falling into sick. So that's the empathy we are going to discuss, and the session is handed over to Monish.
So hello everyone, this is Monish from CSE IoT department. So I'm going to talk about Define. So in Define there are three types of Define I have selected. One is long waiting times and difficulty in booking appointments and lack of transparency in cost. So let's go first on long waiting times. And in long queues for appointments, it means that a big queue or in a big problems of people should stay for an appointment for meeting a doctor. It makes for the delay in treatment, so the patient couldn't get the proper treatment at the time. So difficulty in booking appointments. In many hospitals, still now they don't have any online appointment centers. They are booking for manual appointments, so that the doctor could not meet at the time where the patient need to meet them. So lacks of transparency in cost. So in big hospitals or in a small clinic, there people could not able to have some sufficient of money, so they couldn't be able to treat their problem at the time, and they don't get some proper treatment by the doctors. So they quit their hospital and make their own works. So now hand out to you.
Yeah, myself Mukilan, and I am here to explain about the idea. Basically, our idea is to design a mobile application which is user friendly and used to filter out the hospitals based on the financial status of the users, and it is used to blood and organ availability of the hospitals, like real-time updates of blood and organs which is available across the hospitals. This application is full and fully online consulting with no time limits. It is used to work on 24/7. Next, Samiksha will be take over.
I'm going to talk about the prototype. So here we have listed 6 prototypes. The first one is improved patient outcomes. So here we tell that by utilizing data analytics and AI, healthcare providers can go through the history of what the patient has gone through. So it gives a more clear idea about everything about the patient, so they can give proper advices and consultants. The second point is increased accessibility. We're talking about telemedicine and remote monitoring. So telemedicine is something where we can get consultancy online, and remote monitoring happens when a healthcare provider takes care of the patient in very particular basis. So as a third point, we're going to start about enhanced efficiency. Here we're going to use automation and smart management systems. So here we are going to streamline the processes of administration and consultancy. So here it reduces paperwork and also minimizes errors, because everyone knows how much errors manual paperwork costs. So, and then we'll talk about cost reduction. So, smart care systems can lead to significant cost savings by optimizing online things. So, like when we're using paperwork and manual processes, the hospitals are also overcrowded on one side. And when we talk about the cost of almost everything increases. So, when we do it in online, the cost of everything significantly reduces. Then we're going to talk about patient engagement. So, here we're going to use tools like patient portals and health apps. So, in the patient portals, patients can register everything they have gone through, what the doctors have advised, the medicine they're taking, and the treatments they're going through, etc. So, here it gives a detailed list about everything which is happening with them. Then we're going to talk about data-driven decisions. So, here we use big data analytics. So, here when we talk about a big healthcare organization, there are a lot of patients, and when all of this is done online, big data analytics is like used very well. So all the patient records are like sought and streamed properly. So on a conclusion, we can know how manual healthcare services is very, is a financial burden with inadequate staffing, etc., etc. So it is basically a burden to both the hospitals and the patient. So thinking about the patients who are in an emergency services and etc., it will of course be a long detailed process. And when it comes to smart healthcare management, all of this, the time, the cost, everything is reduced, making the whole process streamlined and more efficient. So here we use, we are integrating artificial intelligence, IoT and electronic health records. So integrating all of these together in smart healthcare management helps to streamline everything properly. Thank you.